where you see the graphic, Nashville CTV Presents, that's what's going to go live, and you'll see the people in the chamber from that.
We're ready to start.
Okay.
Give me a high sign, Jeff. Okay. I'd like to call the meeting of the Budget Review Committee to order. It's May 24th, 2021. And we're holding this meeting via teleconference, although the committee is in the chamber. I'll explain more about that later. As chairman of the Budget Review Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to the meeting, which is authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I'm confirming that we are providing public access to the meeting by telephone with additional access possibilities by video or other electronic means. To access Zoom, please refer to the agenda or the city's website for the meeting link. To join by phone, dial 1-929-205-6099. The meeting ID is 829-8925-9144, and the passcode 174893. To view the public may also view the meeting via channel 16. We previously gave notice to the public of the necessary information for accessing the meeting through public postings. Instructions have also been provided on the City of Nashville's website at www.nashvillenh.gov and publicly noticed at City Hall and the Nashville Public Library. If anyone has a problem accessing the meeting via phone or channel 16, please call 603-589-3329 and they will help you connect. In the event the public is unable to access the meeting via the methods I just mentioned, the meeting will be adjourned and rescheduled. Please note that all votes that are taken during the meeting shall be done by roll call vote. We will start the meeting by taking roll call attendance. When each member states their presence, please also state whether there is anyone in the room with you during this meeting, which is required under the right to know law. Before we get started, this is our first meeting to try and come back into the chamber. There are 3 committee members in the chamber, and the rest of the committee is on Zoom. And this will be a learning curve as we start to take advantage of the new systems in the Aldermatic chamber. Please, everyone, bear with us because we may have learning curves as we go forward, but we will address them as we get to them. So with that, would the clerk please call the roll?
Thank you, Mr. Chairman. Alderman at Large Shoshana Kelly.
I'm here. I'm alone and I can hear everyone.
Alderman at Large Michael O'Brien is present in the chamber with other members, and I can hear the proceedings. Alderman at Large Laurie Wilshire.
I am here.
Alderman Ernest Jetty.
I am here alone and I can hear the proceedings.
Alderman Jan Schmidt.
I am present, I am alone, and I can hear everyone.
Alderman at Large Ben Clemens. Alderman Richard Dowd.
I am present. We're in the chamber.
Okay. Mr. Chairman, you have 6 members present. Also in attendance is Deputy Police Chief James Testaverde, Community Development Director Sarah Marchant, and Economic Development Director Tim Cummings.
And Director of Public Health.
Oh, yes, and the Director of Public Health, Bobby Bagley.
Thank you, everyone. As we go forward, we're going to be testing all the new systems, as I mentioned before. The automatic timers for public comment are in place. When we have public comment, you have 3 minutes. When you have 1 minute left, we will see the yellow light. I'm not sure if you see it on Zoom, but if you do, that means you have 1 minute left, and we'll tell you. And then when it turns red, please finish your thought and please stop talking. If it proceeds, we'll have to mute your mic. Okay, I'm getting all kinds of text messages. I'm not sure. What these messages are. Buzzing when Rick speaks. Fuzzy noise too. Clear it. Noise back. Rick's mic. Buzzing and Alderman O'Brien speaks also. Okay, so IT is on that problem. And we will proceed and.
Chair Dow,
Yes?
Harriet Gathright is here as well.
Okay,
Okay.
thank you. I do see that, and I think we also have
Alderman Lopez.
Alderman Lopez. Thank you.
And I have audio.
And
Okay.
Alderwoman Lou.
Alderwoman Lou, thank you.
All right, for the IT people is a buzz. I'm not sure. We'll work to make sure that we clear that up. So roll call's been taken. So the first order of business is public comment. Is there anyone that would like to speak on anything that is before the Budget Committee this evening? Does anyone see anyone with their hand raised? No? I don't see anyone. So we'll proceed. Communications,
From Matt Sullivan, Planning Department Manager, on behalf of the Conservation Commission. Reason, authorizing request for $24,500 from the Board of Aldermen from the Conservation Fund number 4080 to define and approve the Salmon Brook Trail section between Ingle Street and Burke Street within the Joyce Park Wildlife Sanctuary. Also, we have from Matt Sullivan, Planning Manager, reason, referral of R-21-145 and amendments to approve FY 2022 Capital Improvements Program, CHIP.
there being no objection, I'll accept the communications and place them on file. Unfinished business,
There is none.
new business resolutions.
Before us this evening is R-21-132, approving the cost items of a sidebar agreement between the Nashua Police Commission and the Nashua Police Supervisors Association and the Nashua Police Commission and the Nashua Police Patrolmen's Association regarding a wellness incentive program. Mr. Chairman, I would like to recommend final passage by roll call.
So the motion on the floor is to recommend final passage of R-21-132. Deputy Chief Testaverde is here, and he will come up and give us a short presentation on what this is concerning.
Thank you, Mr. Chair. Thank you, ladies and gentlemen. Over the past couple of decades, the standards, the state standards for physical fitness, due to a lot of smaller agencies.
Hang on,
Alderman Dowd?
can anybody
We can't
hear?
hear him.
Yeah,
No, we can't hear him at all.
Chief, it might be a switch on the mic.
Donna, do you know if that's muted on there?
Do I have it move? I'm not showing muting.
No, it's not.
Have Howard here?
We can always have you sit at one of the desks
Yeah,
too.
That's fine with me. if-
Yeah, you can go sit, yeah,
First one?
yep.
Thank you.
Now, could you pull your mic closer to yourself, though? You can hear me, thank you.
Sure.
Can you hear me okay now?
Yes, we can hear you, but it's the people on Zoom.
Alderwoman Kelly,
can you hear?
could you hear me okay?
I can hear you now, yes.
Thank you very much. Ladies and gentlemen, Mr. Chair, over the past few decades, the statewide standards for physical fitness have fallen to, in my humble opinion, an abysmal level. A police officer in this state needs only to meet the 35th percentile for physical fitness under the Cooper standard. We're not proud of it, and we don't brag about it, but that is the state standard. In an effort, the National Police Department prides itself on having officers that vastly go above that level. But in order to add an incentive to that, to promote physical fitness, which promotes mental well-being and quality of life and longevity, now that the new retirement system requires our officers to do a minimum of 25 to 30 years, the administration, this is not a sidebar where the union came to us and said, we want something, we need something. This is the administration saying we'd like to provide this to our men and women. If they can attain the 80th percentile, they would get 1 day off, a wellness incentive day. If they attain the 90th percentile, which is, I will admit, looking at the standards, difficult, they would get 2 days off. The benefit of these days off, we have it written in, they cannot, no more than 2 members of any shift can take these days off at any given time. They cannot take them on any of the major holidays, and the administration can deny a day if it incurs any overtime. We can allow it, but we can also deny it, so we can manage this within our own budget. I can answer any questions now or get into the weeds if anyone would like, but it's fairly straightforward.
Okay, does anyone from the committee have a question or concerning this resolution? Alderman Wiltshire.
I don't really have a question so much as an observation that 35% seems like the bar is set really low. So I appreciate that you putting this forward so that, you know, we get better traction, I don't know, better service from more police officers. It just seems 35% is a really low bar.
May I respond, Mr. Chair, briefly?
Yes.
I agree with you, Alderwoman Wilshire. And again, my humble opinion, and I'm not bashing any of the agencies around the state, smaller agencies, and speaking to their chiefs and administration, have difficulty getting quality candidates. And the lower some of the standards are, the easier it is to get these candidates in. And if I gave you some of the numbers, again, this is not Navy SEAL standards, but we want our officers to be in much, much better physical fitness levels. So we have some that can do this easily, but the majority would have to work, and it gives them something to, to work at.
Okay, thank you.
Thank you.
Alderman Lopez?
Is there attention given to avoidance of body shaming and that kind of stuff? Because in terms of fitness, there's metrics in terms of productivity, ability to complete tasks like running within a certain amount of time and that kind of stuff. And then there's people who are just built differently. I know one of the first marathons I ever ran, I was not intending to cross anybody, but I did double take because there was a guy standing next to me who was like 300 pounds and like looked like he was a Viking. He caught it and he called me out and was like, "You think I'm going to have trouble with this race?" And I was like, "This is my first race. I've never done anything before." He remembered at the finish line, he was sitting there like eating chili or something. Like, he's like, "Hey, I've been here for an hour. Where have you been?" So there's a difference between being able to perform at a certain level and having metrics that reflect a certain look. So what are the specific metrics for these performances that we're talking about?
I can give you an example through the Cooper standard. I'm going to compare a 25-year-old male to a 45-year-old male, and if any of the aldermen or alderwomen wanted specifics for different age groups and male and females, I can get it for you. But again, I didn't want to give you every specific because I present for about.
Okay, it might be more personal curiosity. I mean, I've met a couple Navy SEALs too, and they come in all shapes and sizes too. So
absolutely, this is a voluntary basis. So all of our officers have to. All but one who was grandfathered in, who started in the late 1980s, everyone from the chief on down, other than this one individual, must take a physical fitness test. And because the state standard is the 35th percentile, that is going to remain the standard, but we're trying to incentivize people to raise that bar. So if they didn't want to take it, the incentive, they don't have to. As far as body shaming, it just doesn't happen, at least in our agency. But I'll give you an example. 25-year-old male, for the 90th percentile, would have to do 57 push-ups, 52 sit-ups in a minute, run 1.5 miles in 9 minutes, 34 seconds, and bench press about 1.5 times their body weight, which meant if they were 180 pounds, kind of an average weight, they would have to bench press 266 pounds. For a 45-year-old like myself, those numbers drop to 90th percentile would be 36 push-ups, 43 sit-ups, run in 10 minutes, 9 seconds, and bench press 1.1% of your body weight. Basically, take your body weight and add 10 pounds. So the Cooper standard goes with age and gender differences.
So that's very different from judging someone based on their weight or that kind of stuff.
Yes.
All set, Alderman Lopez? Alderman Jettie?
Yeah, actually, the deputy chief answered the question that I had. I was just wondering what type of measurements these would require. And I know that I would not qualify to be a police officer. I've always been impressed by our national police officers. I think they, my personal observation is that, they appear, very fit, and I think they represent the city very well. These measurements that you've indicated, shows that it's a pretty high standard that you're aiming towards, and I applaud you for doing that.
I was gonna say, if any alderman can meet those requirements he just stated, we'll give you a day off. Any other questions?
In response to your comment, I probably could, but I'm still legally blind, so it's a pointless exercise.
Okay. Anyone else have a question or comment? Seeing no one? Okay. So the motion on the floor is to recommend final passage of R21-132, approving the cost items of sidebar agreements between the National Police Commission and the National Police Supervisors Association and the National Police Commission and the National Police Patrolmen's Association regarding a wellness incentive program. I think in all of our meetings with the commissioners that this ultimately could save the city money relative to sick time and health and welfare of the officers. So with that, will the clerk please call the roll?
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd,
Yes.
all aldermen that are committee members in attendance, have you voted? Mr. Chairman, we have 6 yeas, 0 nays.
Motion carries. And R21-132 will be forwarded to the full board.
Thank you all. See you tomorrow.
Thank you.
Thank you very much, yeah. Alderman O'Brien.
Thank you, Mr. Chairman. Also before us this evening is R-21-141, authorizing the expenditures of up to $24,500 from the Conservation Fund for work on the Salmon Brook Trail. Mr. Chairman, I would like to make the motion to recommend final passage by roll call.
Okay, the motion is to recommend final passage of R21-141 by roll call. All right, is there anyone here that's going to present this information up? There he is, Mr. Sullivan.
Good evening, Mr. Chair, members of the committee, and I believe Alderman Jettie would like to say a few words as well on this item, but I will provide a brief introduction to the committee on this piece of legislation. This is a request for an expenditure or authorization to spend $24,500 for the purposes of making trail improvements to the Salmon Brook Trail between the section of Ingle Street and Burke Street. The request includes 2 specific items, one being a $21,000 contract with the Student Conservation Association for the labor involved with the improvements, which will be in the form of 2 10-day quote-unquote hitches in the period of June and July. The second element of the request is a $3,000 authorization or $3,500 authorization for materials, including lumber, rebar, and other miscellaneous supplies, which may potentially include the rental of a portable toilet for the job site. I'm happy to answer any specific questions about the trail improvements, but we are pleased and humbly request the committee's recommendation this evening favorably.
Thank you, Mr. Sullivan. Are there any questions from the members of the Budget Committee? I can't see everyone, so speak up if you want to ask a question. Alderman Jettie?
Yes, thank you, Mr. Chairman. I don't have a whole lot to add to what Mr. Sullivan provided in the package for tonight's meeting. There's a detailed explanation of the contract. I was asked to sponsor this by the Conservation Commission. It's a great opportunity to make much needed improvements to the trail at the Joyce Park. We're starting out, a separate item that, another company is coming in to remove the poison ivy that is a hazard on the trail and prevents a lot of people from using it. That's going to be done first. And then, we've got this excellent opportunity to team up with the student conservation group that is going to come in and provide fairly cheap labor and equipment to accomplish these improvements. If you have questions about that, Mr. Sullivan can explain further. But I think the deal that the city is being presented with here is pretty much a no-brainer. The money, by the way, isn't coming from new tax money. It's money that from the Conservation Fund, which the Conservation Committee receives from developers who are who need various permissions or permits to construct projects in conservation areas or near conservation areas. So this money is not really tax money. I know it's all, in a sense, all taxpayer money, but this is not coming, directly from the tax base. So I think it's a great project, and I applaud whoever was responsible for teaming us up with this group. So I don't know if Mr. Sullivan wants to explain further anything about the group, but that's all I have. Thank you.
Thank you, Alderman Jettie. Alderwoman Kelly?
No question here. Just wanted to comment that I'm pleased to support this. I was on the Conservation Commission previously. They do a lot of great work. And I think one of the gems that we have in this city is our conservation and trails. It's really an incredible system. So I applaud them for bringing this forward and look forward to having this taken care of.
Thank you. Is there anyone else that would like to speak? Seeing no one, Alderman O'Brien, would you call the roll for the motion is to final passage of R21-141?
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd.
Yes,
Mr. Chairman, you have 6 yeas, 0 nays.
and that motion carries and will be sent to the full board recommending final passage.
Thank you very much.
Yep. Also before us this evening is R-21-145, authorizing the interfund transfer of $325,000 from the Broad Street Parkway Capital Project activity to the Nashua Millyard Dog Park Capital Project activity for the purchase of the property located at L Pine Street, map 77, lot 5. Mr. Chairman, this is going to require a public hearing, which is scheduled for Tuesday, June 1st, 2021, at 7 p.m. Therefore, Mr. Chairman, I would like to make the motion to table R-21-145 until after the public hearing on June 1st, 2021, by roll call.
Okay, the motion is to table R-21-145. Would the clerk please call the roll?
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd.
Yes.
Mr. Chairman, you have 6 yeas, 0 nays.
Motion carries, and that motion is, our 21-145 is tabled until after the public hearing on June 1st. New business ordinances,
There are none.
tabled in committee.
Mr. Chairman, I would like to make a motion to take from the table R-21-142, which is the 2021 fiscal budget, by roll call.
Would you please call the roll?
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd.
Yes.
Mr. Chairman, you have 6 yeas, 0 nays.
Motion carries, and our 21-142 is back on the table. This evening, we're going to be covering 5 departments from the Public Health and Community Services Division. The first one that we're going to hear is Department 171, Community Services. The appropriations are on page 173. And hang on just a second. Director Bagley, did you want to give us an introduction or?
Yes, good evening, Mr. Chair and members of the committee. I am here with the managers of our 4 departments of the Division of Public Health and Community Services, which is our fully accredited health department for the city of Nashua. Each of the managers will talk very specifically about their departments by giving an introduction to the mission and briefly talk about the services and the function of the departments. We will start off with community services, which is a department, one of the departments that I actually manage. The mission of the department is to facilitate access to programs and services to develop resiliency and promote healthy behaviors within our greater Nashua community with our partners in engagement. Under this department, the staff that is funded by the city is 2.88 FTEs, which includes the division director's position, along with 95% of our epidemiologists and 100% of our health promotion and marketing specialists. All of the other positions under this department are grant-funded positions. And the work that is mostly carried out as Chief Public Health Strategist leading our city function in making sure that we can protect, promote, and preserve the health of the community. In this department, you will find that in this budget, we did come in at the percentage that was asked of by the mayor. And on page 173 of the budget book, you'll see that there's not much changes that were done in these different lines here for this department with regards to what's committed in the budget. So it's pretty much flat funded from the previous year. Wanted to make sure that we are able to sustain the work that needs to get done in this department with the staffing that we do have. Maintain our accreditation status, which we're going into our 5th year, so that's really important for this department. We do have a new building that we will be moving into, and so you'll see under some of the property services, the electricity, the heating and the water, the numbers there are pretty much the same as well. And I don't know if there are any questions with regard to the budget. As I mentioned, as far as our analysis, this budget does sustain this department with the staffing that we have and the support of the grants that fund the majority of the staff under the Community Services Department.
Okay. Is there anyone from the Budget Committee that has a question for Director Bagley? I'm seeing no one. Okay, then we will move on to the next department, which is, give 172, Community Health. Appropriations are on page 179, revenues on page 38.
And Mr. Chair, you'll hear from the Chief Public Health Nurse, Kim Bernard, who is the manager of the Community Health Department.
Okay,
Hi, can everyone hear me?
yes,
Hi, good evening. Thank you for the opportunity to speak tonight. As Bobby stated, I'm the Chief Public Health Nurse for the city, as well as the manager of the Community Health Department. The mission statement of the Community Health Department is to lead the way in disease prevention with community outreach, education, collaboration, and health services in the greater Nashua area. Under our department, we have myself, as well as 3 public health nurses that are covered under the city budget. We have an administrative assistant and 1 community health outreach worker that is also covered under the city budget. And then we have 1 public health nurse and 1 community health outreach worker that is covered under grant funding. Under our department goals, we have several different services that we provide to the community. Some of those include our lead program, where we are testing our children in the greater Nashua area for lead. We also do a lot of education surrounding that in conjunction with our community services department. We also have an STD, HCV, HIV program that we were able to sustain during most of the pandemic. We reopened our clinic back in July of 2020. We were able to set up an MOU with Lamprey Healthcare, which was able to give us, since we're displaced currently, which was able to give us a physical building where we could have our clinics on Thursday evenings. So that partnership has been great. We also have continued our immunization program. Prior to the COVID-19 vaccine coming out, we were able to really do some mass vaccinations with flu last year, as well as just continuing and trying to educate folks that on their, having their children continue with their vaccinations that are due, even though they may have been remote. So we also had an MOU developed between us and the St. Joseph Hospital Mobile Health Clinic, and that's been another great partnership that we've had. So we've been over at Elm Street Middle School. They've been very gracious to have us stay there. And we have been there on Tuesdays. And we've also continued our immunization and other outreach, like our STD testing over at the National Public Library once a week, and some other areas in the Nashua area over the pandemic. So we've really tried to continue and provide a lot of these services while we have been going through this time. We also continue our sauna program, which never stopped during the pandemic. We do that twice a week in conjunction with Revive. And that is a overview of the programs that we are providing. Just to note a few accomplishments that are noted here, I just want to highlight that our community health staff worked over 6,480 hours in response to the COVID-19 effort. This was really a huge undertaking by the division, and the community health nurses really stepped up and did a lot with disease investigation, as well as now transitioning into the vaccine response. And then those MOUs are also one of the highlights that I wanted to discuss. So are there any questions regarding the actual budget items that I can answer?
Any questions from members of the Budget Committee? Alderman Jettie.
Yes, I think, I don't know if this is for you or for Director Bagley, but I'm wondering about the demands that have been put on your departments, because of COVID. I'm assuming, without really knowing, that there was a big demand, and I don't know if you had to hire more staff or whether you had to use overtime. Is that reflected in this budget? And do you expect, hopefully a decrease in the coming year? And what about the money that we got from the federal government and the state to assist us with the COVID crisis? How did that all affect your department, and is that reflected in these budgets?
That's an excellent question, Alderman Jettie. I can speak to some of it, and then I'll have Bobby speak to some of the other pieces as far as some other grants. But I can speak to the pieces where we have received some funding from the CDC, where we were able to hire some temporary staff, 2.5 nurse units, so 2.5 nurses, 2 part-time and 2 full-time and 1 part-time. We also are using some Fema funds for staffing some per diem nurses for the vaccine efforts. So that's rather a newer thing that we've taken on. We've also, to answer your overtime question, our nurses are all salaried, so they have not received any overtime for any of the hours that they have put in, the extra hours. In the future, we are going to be, we're anticipating that we are going to need more staff. We would like to, be able to have 2 to 3 more nurses on board through the city. We anticipate that we're going to be, doing COVID boosters, and, COVID is not going to be going away anytime soon. So we will be dealing with COVID for years to come. So we anticipate those needs. Bobby, was there anything else that you wanted to mention surrounding that?
Able to add more to answer Alderman Jetty's question?
Yes. Was there anything I missed?
Mr. Chair?
Yes, go ahead.
So, in response to Alderman Jetty's question, so the funding that we have right now for the COVID response is emergency funds. It's all temporary. We have 1 more year of funding through some of the, what we call, it's the epidemiology and laboratory funding. We'll have that for 1 more year. That has allowed for us to cover the cost of some of the per diem nurses that are working currently to support some of the vaccination efforts, some of the disease investigation and contact monitoring. The FEMA grant that we received that the Chief Public Health Nurse Kim spoke of will last for the rest of this year, fiscal year, and then, it ends in December. And so that funding is temporary. And then we also had the additional support from the CDC, which they actually hired the staff for us and deployed them. So we didn't actually get any money through the CDC Foundation. They hired the staff and deployed them to our public health department. That contract ends on June 30th. And so those 2.5 FTEs that the Chief Public Health Nurse spoke of, they will be ending at the end of June 30th. The work that will continue to go forth, because there's the impact of COVID and the increase of vaccination efforts that will need to continue throughout this year, and the expectation of vaccination clinics going into next year, where that additional staffing is going to be needed. We don't know what the funding will look like going forward. For right now, there's quite a bit of funding that's come from the federal government to support these efforts, but it's all temporary. And so we will have a gap once the CDC nurses, their contract expires in June, and we do have the per diem staff that we have right now that FEMA will cover the expense of that staff. The FEMA funding does not cover any additional overtime of our public health nurses, which are salaried.
And all set, Alderman Jetty?
If I could follow up.
Follow up?
Are you saying that the additional expenses that may have been caused by COVID were covered by the state or federal governments, and they were outside these last year's budget and this year's budgets? or this coming year's budgets, and so they're really they're accounted for otherwise. They're not in here and don't need to be in here.
So the majority of the funding that we receive to cover the cost of the additional work is covered through grants. The city budget does not include funding to hire any additional public health nurses.
All set, Alderman Jenny, or follow-up?
No, I guess that's all I have. Thank you.
Anyone else have a question on this department? Okay, I have just a couple of questions. Just for clarification, on line 51-412, wages per diem, this, in 2020 spent to date 41,000. And I assume that funding came from federal funds? If so, why would we reflect it here?
Alderman, those were city funds, and we were over budget. And that was due to the COVID-19 response, and that was prior to us getting all of the federal funds and the CDC foundation nurses.
So,
That was, I can tell you that the majority of those funds were used to pay nurses to do disease investigation, contact tracing.
do you know whether that line item and also 61-110 protective clothing, which was PTP, I'm sure, in 1909, are being ultimately covered by funds coming into the city from the relief? Or is that a question for John Griffin?
Could you repeat that question?
Well, you said the 41,228 under wages per diem came out of the budget, put the budget over. And also on protective clothing, which I assume is PPE, 1,909 with a budget of 300, it seems to me like that might be something that would be covered under federal reimbursement. We know whether it is?
Yes, Mr. Chair, I believe that.
Okay,
Yes.
all right.
This is, so I'm sorry that buzzing, I'm not sure if you can hear it, but there's the buzzing is loud on our end. But if the finance, if John Griffin can answer, I do believe that this is funds that can be reimbursed. You know, there was something, funding that went over budget that could be applied to FEMA reimbursement for the city.
Okay.
And I'm not sure if Griffin can hear us.
Mr. Chairman, I can check that and get you an answer for the full board. Thank you.
The other question I had is on what was it? Disposal services. Can you just tell me, may keep the question from being asked, what are the disposal services?
That is Stericycle. That is the disposal of any bloodborne pathogens, whether it be needles or other items that are contaminated.
So do you handle disposal from the general public if they have? No? Okay. And do you know if they're still doing that at the hospitals?
They are. Yes, both hospitals do accept. You're speaking of needles?
Yes.
Yes, both hospitals do accept that, and as well as our sauna program.
All right, thank you very much. If there are no other questions,
You're
we'll
welcome.
move on to Department 173, Environmental Health, which is on, appropriations are on page 183, revenue 139. By the way, the revenue lines seem to be staying pretty stable. So unless anybody has any specific revenue questions, we'll move on to the next expenditure, which is Department 173, again on page 183.
Mr. Chair, you'll hear from our health officer, Heidi Peak, who is the manager of the Environmental Health Department. She'll give an overview of this department as well as explain the budget line items here.
Good
evening. Good evening. Mr. Chair, Alderman, thank you very much for giving me the opportunity to go over tonight, the budget tonight. Environmental Health Department is a small department. There are 6 of us. Our mission is to protect the public's health by promoting best prevention practices through science, education, guidance, and fostering public trust and enforcement of laws and ordinances. As the Chief Public Health Strategist for the City of Nashua, the Environmental Health Department protects and promotes the health of the public by defining, eliminating, controlling, and managing environmental health hazards. This is accomplished through the enforcement of laws and ordinances that protect the public from specific harmful environmental conditions. And I'm sure that a lot of you are familiar with our programs. The largest one is food service. We also do some foster home inspections, some school inspections, whenever they're required by Department of Education, child care inspections, septic system approvals, and we work with the animal control officer when it comes to rabies investigations. We work together to make determinations about what happens to for testing if there is a human exposure. We kind of work in 2 realms in that we are an enforcement agency, but we also try to deliver that enforcement primarily through education. And so I appreciate our workforce being able to identify with our business owners, being able to handle complaints from the general public, but also be mindful that a lot of what we do is talk people through things, a lot of hand-holding and explanations of why and the relevance to what we do. Along with myself, I have a deputy health officer, Ren Bodwin, an office manager, Linda Alaconis, and we have 3 environmental health specialists, April Torhan, Michael McGinnis, and Tim Poitras. And we are fully funded by the City of Nashua. And COVID really put, it was a different world for us this past year. And we employed throughout the division an all hands on deck approach. And so that meant that when the shutdown occurred, food service wasn't operating. And so we answered the hotline. We helped conduct disease investigations. We did contact monitoring. We were right there with everyone else. And we're just now moving back to more of our routine activities. But so we're always trying to improve those processes, making them a little bit more understandable for the general public. We are working now with CivicGov to get the licensing and permitting software implemented within our department. It's a little challenging right now because our old VAX has now gone away, and now we're having to manually put some things in. But we'll make it through it. So you'll see that our performance measures are a little wonky as opposed to previous years. We didn't do routine food service inspections. We responded to complaints. We went over social distancing. We responded to the Attorney General's office when they received complaints. We acted as the DHHS's eyes and ears in Nashua. And so we are resuming food service inspections, and So it was a very different year. I served as the safety officer for the COVID activities and actually followed up with some of that work today and looking at Arlington Street Community Center and their resumption of programs, and walked through City Hall with a member from RISC to assess the safety of the meeting spaces within City Hall. And we did spend a lot of time with our food service partners out there, but it was in the changes to the guidelines and the requirements, it was walking the business owners through a lot of those steps, and also following up with COVID positive food service workers, business workers, etc. So it was a very different year. Ren, our deputy health officer, serves as the accreditation coordinator, and so his work on that is vital. And we also took the lead of protection of food service workers in coordination with the vaccination clinics. And I know that, again, that's another example of all hands on deck. We've had staff at vaccination clinics, at testing clinics, and we will continue to provide support. But we spend a great deal of time as subject matter experts, if you will, about ventilation systems, disease transmission, cleaning surfaces. What does that mean? How can we reopen this? How can we get this other activity going within the community? So that's taken up a great deal of our time. As far as the budget numbers, we came in where we were supposed to. There were two lines that were reduced a little bit, but I'd be happy to answer any specific questions.
Okay, thank you, Heidi. Does anyone from the Budget Committee have any questions for Department 173, Environmental Health? Alderman Jettie?
Thank you, Mr. Chairman. So I noticed under on the revenue pages, we have you have food service licenses that generates $115,000 a year. Plus there are spa and pool licenses, solid waste licenses, and septic license fees. But I'm particularly interested in the food service licenses. I know that that our your department is its primary function is to protect the public and make sure that people who are in the food service industry are abiding by the various rules and regulations concerning the temperature at which they keep their refrigerators and freezers, and what they cook at, and different things of that nature. It's all to protect the public, but it also enables those businesses to generate income for themselves and their employees and their owners, etc. So I'm wondering, have we looked at recently? Have we looked at how our fees, the food service license fees, compare to other, cities, towns in New Hampshire, in Massachusetts, Maine, in surrounding areas? Are we charging an appropriate amount for what ultimately is a service that enables these food service providers to run their businesses?
Thank you for your question. Our fees are very old. We haven't raised our fees in a very long time. And it certainly didn't seem like the right time to do that with all that we were going through. So in comparison to other communities that would take a little bit. I would be happy to look into those numbers and try to figure it out. I think that we're probably running a little bit cheaper than Manchester. I haven't looked at Concord's for a while, and I think Portsmouth might charge a little bit more as well, but I'm not certain on those. Those are kind of off the top of my head comparisons.
All set, Alderman Jenny, or follow up?
If I may follow up, yeah, I don't want to overburden you, but you know, if it's possible for you to obtain that information, you know, it would be something I would be interested in learning the results of that. You know, I don't want to penalize anybody. I don't want to, you know, make business any more difficult than it is. But I also, you know, think we.
She knows we can't hear her.
Evidently, the people on Zoom can hear each other, but.
Yes, I can hear you.
New technology.
Isn't it
Yeah,
great?
I heard Jan.
Good. I'll be careful what I say.
Right?
Must be that rep power to get voice.
Anything? Nothing?
No, I think, are we good?
Alderman Jettie, can you hear us?
Yes, I can hear you. Can you hear me?
Okay, perfect.
Alderman Dowd, can you hear me?
Apparently not.
We can hear you.
President Wilshire is there.
Yes,
Yes.
she is.
Can they hear us or not?
Oh, we can hear you again.
Oh, okay.
All right, we're back on. So did you have a follow-up, Alderman Jettie, or?
I don't know when you lost me. I was saying that. Did you hear my question to Ms. Peak about you know, whether or not the fees that we charge for food service licenses?
We heard that. We heard that
okay.
the fees are old and that, I didn't know if you had a follow-up to her answer.
You know, just to finish this off to make sure everyone is on the same page. So when she answered, she said that that she would be willing to look into that. And I said I did not want to overburden her, but if she could obtain that information, that's something I would be very interested in.
Okay, I just want to reiterate that any data that comes in from questions asked at one of these meetings should go directly to Donna, the legislative assistant, and she will make sure that everybody on the Board of Aldermen get the answers. All right?
Yes, that's fine. That's, of course, that's,
No, I didn't know if they knew. I knew we knew. But- All right.
okay.
Any other questions for this area? Seeing none, thank you, Heidi.
Thank you.
The next department is Welfare Administration. The appropriations are on page 188.
Right, Mr. Chair, you'll hear from our welfare officer, Mr. Bob Mack, who will give an overview of his department, the staffing, and some highlights from the program, as well as go through the budget. And Mr. Chair, I did hear that the question you asked about the overage in the per diem line from community health, that 41,228 will be reimbursed through FEMA funds. We did put in for reimbursement for those funds to the city.
Thank you.
Mr. Mack?
Good evening, Mr. Chairman, members of the committee.
Evening.
Thank you for this opportunity. I hope you can hear me okay.
Yes. Yep.
Terrific. So the welfare department, again, I am manager of the welfare department as the welfare officer. We are made up of a total of 6 staff. It's myself, a senior case technician who operates as a backup in assisting to manage the department. We have an intake worker and 3 case technicians. We operate under the mandate of RSA 165, which says that every municipality in the state of New Hampshire must provide some form of general assistance in accordance with written guidelines to those who are eligible and in need of such assistance. The mission of our department is to promote, protect, and preserve the health and well-being of our community by helping individuals and families to achieve self-sufficiency through direct assistance or referrals to other community resources to meet basic needs. So through our day-to-day operations, we spend a lot of time assessing cases, taking applications from people that seek assistance, collecting documentation and verifying documentation and need, and assessing what we may assist with or what they may be able to get through some other agencies in the community. We work very closely with our community partners, nonprofit organizations. The basic needs for which we look to assist with include housing, utility assistance, food, sometimes prescription assistance, and occasionally burial or cremation assistance for indigent folks. Again, we work very closely with our community partners. Throughout the course of the COVID response, the welfare staff have also been providing support and assistance to the division in supporting hotline calls and working at some of the vaccine and testing clinics as necessary to support the other division staff and community health. One of the big items, if you will, that has come across the state of New Hampshire has been the federal funding that has helped through the COVID situation with emergency rental assistance and utility assistance. We have referred a number of folks that have contacted the welfare department to those resources if they have had direct COVID-related financial hardships. So in looking at the assistance, I think in our part of Hillsborough County, Southern New Hampshire Services has assisted with approximately $3 million in assistance for emergency rent and utility assistance due to the COVID situation. That has helped to reduce our need to help directly, as it has also helped other nonprofit organizations in our community to not have to spend a lot of their budgeted money, actually, because these other resources have kicked in. So that's been a big help to those in need in our community, and it has helped us save some money as well. So that is a basic summary of the department. We do have two budgets. We have our operational budget which had some minor adjustments with it, primarily staffing. We're pretty much made up of it. Our expenses are related to our staffing. We don't have a lot of other overhead there. And then our general assistance budget, which is the money that we issue out to vendors to support those in need that apply for assistance and are determined eligible. With that, I don't know if there are any specific questions, Mr. Chairman.
Are there any members of the Budget Committee or other aldermen that have questions? Alderman Jettie?
Thank you, Mr. Chairman. So, Mr. Mackey, you may have answered this, but I'm struck by the your proposed budget is being approximately $70,000 less than what you budgeted for last year. In this climate, how are you going to be able to do that? How are you going to be able to reduce that budget?
Mr. Mack?
Yes, Mr. Chairman. Thank you, Alderman Jettie. Yes, we were able to come in and reduce our general assistance budget by about $63,000. This was partially based on some of the other emergency assistance funds that have come into the community, but it is also based on what we're projecting as the potential need moving forward. To date, we've expended around $327,000 of our budget of $540,500 for this current fiscal year, which is about 60% of the budget. Again, those emergency funds that are out there, they're not going to be around forever. But that being said, we do have very good working relationships with our community partners. We oftentimes will pay portions of rent due, and they will cover other portions of the rent due. So we plan to continue with that aspect. And we will evaluate and assess this general assistance budget as we go through the upcoming fiscal year. If by chance we did not have sufficient funding in the general assistance budget, we do have the Welfare Expendable Trust Fund, which has around $372,000 in it. We're hopeful that we won't need to utilize that fund, but it is there. We don't count on that fund as we budget, but we try to predict where things are going to go and where things are trending. It has been an interesting year to try to track that trending, because we've seen a significant influx of funding, both through the emergency assistance programs as well as different stimulus funds that have gone directly to individuals in the community. So it has been a little tricky to try to track that and balance that out, but we're pretty confident that we should have sufficient funding with, I think we budgeted around $400,000 in the shelter line itself, which is the largest portion of our general assistance budget. So I hope that addresses your question, Alderman Jettie.
Yes, thank you.
All set, Alderman Jettie?
Yes, thank you.
Alderwoman Lou?
Thank you. Mr. Mack, how long will the excuse me, the funds that the federal funds that you've depended on, how long are they due to continue? To the end of the year or until June?
As I understand it, they are supposed to extend through the end of the calendar year. And I think that they may be reevaluating these things as they go as well, pending any other orders, either from the president or congressmen and senators and representatives.
Okay, thank you.
All set, Alderman Lou?
Yes.
All right, thank you. Yeah, and by the way, we were covering both the departments 174 and 175. I just had does anyone else have a question? Yeah, I just had a couple. I noticed your cellular telephone actually, expenses are tracking about right, but they're double for this upcoming budget. Is that for additional staff or?
Yes, Mr. Chairman, that is to add the senior case technician to cover the use of her phone because she uses her personal cell phone for work-related calls, checking emails and things like that.
Okay, the other question I have is on line 55,699. Other contracted services went up from $100 to $1,000. Just curious what that is.
Yes, Mr. Chair, that is to account for the utilization of the language line. If we have clients that do not speak English proficiently, we have some staff on board that speak different languages, but if there's a language that we don't have a staff person that can communicate directly with the client, we may need to call the language line and have utilize that interpreter service over the phone.
Okay, thank you. Any additional questions from anyone? Okay, thank you very much.
Thank you.
That concludes the Public Health and Community Services Division. Alderman O'Brien.
Thank you, Mr. Chairman. I would like to make the motion to table R-21-142, the municipal 2021 budget by roll call.
Okay, would you please call the roll?
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd.
Yes.
Mr. Chairman, you have 6 yeas, 0 nays.
Motion carries, and R-21-142 is tabled until the next budget meeting, which I believe is Thursday. General discussion? Is there anyone that has anything that they would like to discuss? All right, seeing none. Public comment? Is there any members of the public that would like to be heard? Seeing and hearing none. Remarks by Alderman. Alderman O'Brien.
I like to say that it took a old Navy guy and a Merchant Marine guy to take this out for its maiden voyage. I don't think we hit anything, so I think we did all right. We have some minor glitches, but we'll work it out. But my pleasure to serve with you.
Thanks. I think that's why we wanted to get this started, so we didn't wait till we had a full board in here and had all these glitches. We had a few, we'll see if we can get them all straightened out before the next meeting. Alderwoman Kelly, did you have something?
It did. Can you hear me? We're back to hearing buzzing on your end.
Yes.
Okay. I just wanted to say that I really appreciated all of the people from Community Health who stepped forward. I know it's been an especially tough year for them. And God, I wish I could give them all raises because we needed them more than ever in the past year. So thank you for your hard work and for coming and talking to us about your divisions.
Thank you. Anyone else? I just want to, again, say that, you know, we, as Alderman O'Brien said, this is our first session in the new chambers. We've had a few practice rounds, but this was the first real live broadcast, and we're working out, we have the entire TV crew here to work through all the issues. I am gonna go out on a limb and say, is my microphone working better now than it did before? No? I'm getting no's from all over the building.
Buzzing right now.
Yeah,
We can finally hear you, he says.
finally hear me, they say.
I can hear you, but I can also hear a high-pitched noise and a scratchy noise over it.
That might be your female bird there in the background.
No, she's sleeping like a good girl.
No, I'm
She's
hearing it
sleeping.
too. I'm hearing it
Can't
too.
blame the baby. He's not here.
You wish.
Yeah. Well, we'll get it fixed. So we don't need a non-public. Alderman O'Brien.
Thank you, Mr. Chairman. I would like to make the motion to adjourn by roll call.
Please call the roll.
Alderman Schmidt,
Yes.
Alderman Jettie,
Yes.
Alderman Wilshire,
Yes.
Alderman O'Brien votes yes. Alderwoman Kelly,
Yes.
Alderman Dowd.
Yes.
Mr. Chairman, 6 yeas, 0 nays.
Motion carried, and we are adjourned at 8:15 PM. Thank you, everyone.
Yay.
Thanks, folks. Good night.